So here's our pretend ulceration on the left first metatarsal head. I'm going to use 1/4 inch adhesive felt to complete this. And what I want to do is I want to measure from the base of the heel to just beyond the toes. That's how long you want it, because you want to incorporate the toes in this thing. Now we have to make sure that we cover the ulcer, because we're going to mark this with lipstick here in just a minute to show you how to mark the place we want to relieve. So we've got to cover the ulcer to protect it temporarily. This is just a temporary dressing that we're putting on. I usually like to use Tegaderm, but there's many other options out there. Now I take my lipstick and I mark the location of the ulcer. Patient then stands up, or if she's sitting, they press their foot down again, starting at the base of the heel, and then we're just going to mark the foot. We're going to draw an outline on the foot. Once the patient lifts up, now we see exactly where that lipstick imprint is, and we know where the relief needs to be cut. So using some heavy-duty shears, and I would recommend some heavy-duty shears in this case, we're going to cut out that outline as close as we can. If you try to do this with bandage scissors, it will not work. So if you're going to use adhesive felt, at least the 1/4 inch felt that I have here, you're going to need to get you a set of real scissors and some that are sharp. So now that we've got the outline cut out, let's go ahead and cut out a little relief. Now I want to go just beyond the borders of the ulcer. And I'm not going to make a donut. I'm going to leave a little opening there so we can adjust it. And it's really important that you bevel the material at this point. 1/4 inch is pretty high, and so you could actually get some edge pressure that could cause problems with the patient's skin. So make sure you bevel all the edges. And again, these big scissors really help with this, because they cut through this material pretty easy. You might be able to get away with bandage scissors on the 1/8 inch felt, but not the 1/4 inch felt. And so I'm even beveling the area around the ulceration. Edge pressure is a real problem, especially with our patients with insensitivity. So we want to reduce the stress and the pressure on the skin as much as possible. And I'm going to round off any corners that might be sharp that also could cause a problem. Best to make everything rounded, soft, and dull if possible. And so there's the completed product. So now we've got to remove the transparent dressing so the ulcer is exposed again. And this is an important step. We use skin prep to clean the skin. Skin prep is nice because not only does it clean the skin, but it leaves behind a tacky protective layer on the skin. So I'll clean all around the ulcer, all around the foot. This will allow this thing to adhere. Make sure you let it dry. I will usually fan it dry for a few minutes before I try to put this on. So then you pull the adhesive off, or the adhesive cover off, and place it on the foot. And you can see I have a nice relief there for the ulcer. This patient can wear this around, wear it in the shoe if it will fit in the shoe, or you can use it in conjunction with some other type of offloading device. Then you apply the dressing directly over this and secure it with tape. Tell the patient to change the dressing every day, but to leave the adhesive felt in place. We can usually leave these in place for about a week. I'll make a couple extra pieces of adhesive felt for the patient that are cut just like this one, so that if the patient gets it soiled or it gets wet, they can replace it. I also give them some skin preps that they can use to clean their skin. So this is adhesive felt. It works really well. It's very inexpensive, it's quick, and it will do a good job at relieving pressure.